The SARS coronavirus (SARS-CoV) causes SARS. A coronavirus is a common form of virus that typically causes upper respiratory tract illnesses. The common cold results from a kind of coronavirus. 6 different kinds of coronavirus are known to infect humans. 4 of these are common, and most people will experience at least one of them at some time in their life. The 2 other types cause SARS and Middle East Respiratory Syndrome (MERS). These are less common but far more deadly. Before SARS appeared, coronaviruses had not been particularly dangerous to humans, but they had been known to cause severe diseases in animals. As a result, scientists first thought that animals transmitted SARS-CoV to humans. They now believe that an animal virus changed into a new, more deadly strain. What are the causes? Droplets from coughing and sneezing and close human contact likely transmit the SARS virus. The respiratory droplets are probably absorbed into the body through the mucous membranes of the mouth, nose, and eyes. This could be through hugging and kissing, sharing utensils for eating and drinking, speaking to someone within a distance of 3 feet, touching someone directly. A person with the virus can spread the infection by leaving respiratory droplets on objects, such as door handles, doorbells, and telephones. These are then picked up by someone else. The virus is likely to remain active in the environment for several days. What are the symptoms? Symptoms normally appear within 3 to 5 days after exposure to the SARS virus, but they can develop after 2 to 7 days. During the incubation period, before symptoms appear, the disease is not contagious. Most cases of SARS begin with a high fever. Other early symptoms include those common to flu, such as aches, chills, diarrhea, dry coughing, and shortness of breath. These will develop over the course of a week. Patients may go on to develop pneumonia, an infection of the lungs. Serious complications, such as respiratory failure, heart failure, and liver failure may occur. These complications are more likely in people aged over 60 years, and those with pre-existing comorbidities, such as diabetes or hepatitis. What is the diagnosis? The World Health Organization (WHO) advises that, to be diagnosed with SARS, a person must have all of the following: a fever of at least 100.4 degrees Fahrenheit or 38 degrees Celsius, 1 or more symptoms of lower respiratory tract illness, a cough, difficulty breathing, shortness of breath, radiographic evidence to suggest a diagnosis of pneumonia, no alternative diagnosis to fully explain the illness. SARS is very rare, and the symptoms overlap with those of flu and pneumonia. A physician will not suspect it unless the person has been in an area where there is an outbreak. What are the preventions? As with other infectious diseases, some simple steps can be taken to help prevent the SARS virus from spreading. Good personal hygiene practices can help restrict the spread of the virus. These include frequent hand washing, avoiding touching the eyes, mouth or nose with unclean hands, covering the mouth and nose with a tissue when coughing or sneezing, and encouraging others to do the same. Because SARS is contagious once its symptoms have developed, anyone with the disease should limit their interactions with other people until 10 days after their symptoms have improved. SARS is at its most contagious during the 2nd week of illness. Is there a vaccine? There is currently no vaccine against SARS, but scientists are working on one. In 2013, researchers announced that they had found a way to disable a part of the virus involved in SARS that allows it to hide from the immune system. This could lead to the development of a vaccine against the disease. Since 2004, there have been no recorded cases of SARS anywhere in the world. Health organizations continue to work on a response, in case SARS reappears in the future.